Dr. Peter Hong is an infectious disease specialist at the University of California, San Francisco. He spoke to my colleague Mike Walter about some of the successes and failures in the handling of the pandemic.
So in the last year, probably the biggest silver lining is the rapid development and rollout of the vaccines. You know, the 1 year following the vaccine rollout, that is huge. That is like as important as sending a man to the moon in my estimation, because it led to hundreds of thousands of lives being saved, even with focus also on the lives that could have also been saved in addition. It nevertheless led to that remarkable achievement. It led to us going about lives a little bit more normal than early in the pandemic. And it led to kids going back to school to some regard. Of course, there were disruptions, but nevertheless, that continued to happen. And it led to people reuniting, hugging each other, seeing friends, seeing family, seeing parents and grandparents and uncles and aunts. And I think, again, we focus so razor sharp on vaccines, and I think a lot of people have forgot about the other interventions that we need to use, and they've become so political, like wearing a mask means that you don't want to support personal freedom. And that as a healthcare intervention makes so little sense to me, and in fact is demoralizing. I think other silver linings are really the other therapeutic developments that we've made, oral agents for COVID, and figuring out how best to treat people once they're in a hospital. And, you know, even though I've decried not enough use of testing, rapid at-home testing has also been a boon, although we need to see governments pay for this more often, like they do in some countries like the UK and South Korea.
Some of the things that we're also seeing emerge, variants, Delta, of course, of great concern as much of the year went by, Omicron coming up at the end of the year. Talk to us about 2022 and your concerns about these continued variants, because you're going to continue to see mutations. What are your fears moving into the next year, and what are positive signs you see moving into 2022?
I think what we will continue to see is more of these variants being created. But as we roll out vaccines more and more, and I do hope that more and more people will get them, what we will realize over time is that really is the most powerful way to prevent hospitalizations and deaths. But at the end of the day, all this is going to make us safer. We are going to realize that the vaccines are going to be the way to prevent hospitals from being overused and to be protected so that we can take care of people with non-COVID illness. And I think more and more requirements around that vaccines will be instituted in the next few months.
When does the pandemic end? I mean, your sense of when we actually can emerge from this?
It's going to last for 1 to 2 years, because, again, sounds like a broken record. We can't really get ourselves out of this until everybody in the world has either been vaccinated or has gotten COVID. And of course, nobody wants to get COVID intentionally because of the potential loss on life and the onslaught and utilization of hospital resources.